Is this yellow or gold?
Mustard.
Hmm?
Mustard.
Mustard?
Super helpful.
All right, we are live. You might have to remind them when they do their roll call that they're
Sorry.
right there.
When I attended bar, I sometimes would show it too
Did you
far.
just see that? There's a commercial though, they just do that.
But
Why
that's-
don't you do that?
yeah.
Okay, you're good.
Okay, good morning, everyone.
Good morning.
We are officially underway as of 10:34 a.m. We'll begin with an invocation and then the pledge. I'm doing the invocation and our administrator will do the pledge. So those of you who wish to join me in the invocation, please feel free to do so. Heavenly Father, we gather again today to do the business of the county and ultimately to do your work. We're mindful of disease and stress and uncertainty locally and across the land, and we look to you to guide, guard, and protect. As we go forward, please give us wisdom to do the right thing. If we disagree, to do it without being disagreeable, and to be mindful of the goal that's best served by working together. We ask these things in your name, in the name of the Son and the Holy Spirit. Amen.
Amen.
Mr. Chair, are you ready? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
If you want to drink my Coke, feel free. Oh, you're fine. I wore my Michigan shirt. Okay, well, please call the roll.
And say where you're coming in from Zoom. Chickering,
Here, zooming from St. Joseph, Michigan.
Curran,
Here, zooming from Niles.
Terry Freeland,
Present on Zoom from Baroda, Michigan.
Harrison,
I'm present from Lincoln Township on Zoom.
Hugo,
Here from Zoom of St. Joe Charter Township.
Hinkleman,
Yes, I'm here from Bainbridge Township on Zoom.
Majerick,
Zooming from Niles, Michigan.
Meeks,
Here on Zoom from Ben Charter Township.
Scott,
Here, New Buffalo Township, Berrien County, via Zoom.
Borak,
Here in Coloma on Zoom, the number one district.
Yarborough,
Present, City of Benton Harbor on Zoom.
Elliott,
Here from the boardroom.
both present, Chair.
Thank you. I understand we have some minutes to approve and may have been a late change, but assuming everyone had time to go through those, is there a motion to approve the minutes as revised and submitted?
Commissioner Meeks approved the amendment.
Michael Majerick, I second.
Moved by Meeks, supported by Majerick. Or the clerk will please call the roll.
Chickering,
Yes.
Curran,
Yes.
Freeland,
Yes.
Harrison,
Yes.
Hugo,
Yes.
Hinkleman,
Yes.
Majerick,
Yes.
Meeks,
Yes.
Scott,
Yes.
Borak,
Affirmative.
Yarborough,
Yes.
motion carries.
Thank you. Madam Clerk, please tell us about communications.
Received email on November 12th from David Allen regarding other sanctuary resolutions for your consideration. Received email on November 18th from J.B. Hoyt announcing his retirement from the County Planning Commission and County Parks Commission effective 12/31/2020. That's all.
Thank you. COVID-19 update. I see Nikki. Let me get my glasses on so I can see better.
Dr. Hamill's there.
This is Lauren, I'm here
Okay.
as well.
Okay, very good. You folks have the floor.
Nikki, would you like to start?
I will cede my time to you to get us started.
Or I can start, either one.
Yes, thank you.
Was that a yes, Nikki?
Yes.
All right, Jessica, would you like to, oh, you've got the screen shared. All right, we'll go through this. I'll give you a quick overview from the perspective of the health system. Obviously, Nikki will have some additional things related to the health department. Obviously, she's in the business of decreasing the spread and the impact of the disease. I'm in the business of trying to save lives once people get the disease. Let's go to the next slide. You'll see there a picture of the number of positive tests each week in the blue bars and the number of total tests each week in the orange line. You can see early on we had a test positivity that ran around 15%, but we weren't doing a lot of tests. You can see over the summer we had a test positivity well below 5%, and we were doing a couple thousand tests every week. You can see most recently our test positivity is now well above 20%, and we're doing twice the tests that we were in the summer. So in the comparison over the summer, twice the tests and 5 or 6 or 7 times the positivity. That is the making of a very serious outbreak or pandemic in our county. Next slide. You'll see.
I think we lost Dr. Hamill for a moment. He froze here, but you can see in this graph very clearly that the health system, and I don't want to speak too much to their data, but you can see in this graph that as the amount of cases in the community have increased, that has also been something that has impacted the Spectrum Health Lakeland team members as staff reflect and have the same sort of exposures out in the community.
Nikki, I'll stop sharing until he gets back, and then if you want to just provide maybe additional updates from your perspective.
Yeah, sure, that would be great. So the trends that Dr. Hamill is sharing and has in his presentation, those show the inpatient trends. We are continuing to see similar community-based trends in throughout the whole community. We're seeing the increases. And I'm working to share my screen with you all here. Forgive me for a moment. So this is the epi curve that you have seen from me numerous times. And this is the number of confirmed cases throughout the course of the whole pandemic. We right now are sitting at a point where we have over 140 new cases coming on average per day. I think actually this morning we had over 100 cases in the queue before 7:30 a.m. So we're on path for continuing to really exceed that. The number of cases that are happening in our community, they're doubling every 10 to 14 days. So last Wednesday and Thursday, we were right around 100 cases. And following that pattern, we predicted by Thanksgiving, we would be at about 200 cases per day. And we are on our way. We're seeing that in the data to where we're on that path by Thanksgiving to have an average of 200 cases per day. Continuing doing the math, 2 weeks after Thanksgiving, we could be at 400 cases per day. That is the nature of exponential growth. We don't grow where it's 10 or 20 more new cases. Every case, if it's leading to 2 more cases, you get those really sharp increases in the number of cases. Similar to the data that Dr. Hamill provided about the percent positivity amongst Lakeland cases, this graph is showing that percent positivity globally, so it includes other test providers. This data is a few days old. Our latest numbers put us at over 19%. So within the Spectrum Health Lakeland, where there is more of a focus on slightly more ill people showing symptoms and needing doctor's orders, that's over 20%. Here is the broader community, we're seeing close to 19. So at the same time, we've seen our cases more than increase more than tenfold since the beginning of October. When we look at percent positivity, that has increased sixfold since the beginning of October. I'm going to skip over hospital trends right now because I know Dr. Hamill will be able to speak to that in a little bit more depth and probably has a similar looking graph. And when we look at death trends, because that's another important thing for helping us understand what's going on in the community, we are seeing an increase in the number of deaths and our trend. We know that many of these deaths have come from a skilled nursing facility that is currently experiencing an outbreak. And we know that there are tragic results when the virus is transmitted and there's outbreaks in that type of setting with vulnerable individuals. But we are seeing some deaths outside of that skilled nursing facility as well. So we do expect that as you have that really sharp increase in cases, you have an increase in hospitalizations, you will see an increase in deaths. Fortunately, our highest day so far has only been 5. For the most part, it's 1 or 2 per day, but those increases are certainly something we want to pay attention to. I'm not sure, Dr. Hamill, if you're back,
I'm back
online with us. Great. Well, I'll toss it back to you to dive a little deeper into that hospital data. Are you still there, Lauren?
Are you guys able to see my screen okay?
Yeah, we can see the screen. I don't know that we have Dr. Hamill with us still.
Yeah, he's showing up on, he's showing like he's in there, but his video and audio I'm not seeing is connected.
Okay.
Seems to be a broadband issue. Huh. Go figure.
Oh, let's see, he's just, there he is. Unmute. Dr. Hamill, we need to unmute.
All right.
There you go.
Let's go ahead to the next slide. So here's our COVID inpatient census over rolling 7 days. And you can see we peaked a bit over 20 in May and early June. We now are, as of this morning, at 61. Our next 7-day rolling census will be around 60. You can see a significant increase. Next slide. So many have asked about the racial and ethnic impact of COVID-19, and I have a couple slides here that will make that, I think, very clear. As of yesterday, we had over 5,000 cases of COVID diagnosed and suspected cases in Berrien County. 18% of those are among our Black population and 71% of our white population, 8% Hispanic. You can see in terms of admissions, about 1 in 9 were admitted who were diagnosed with COVID. And our Black neighbors have taken a disproportionate share of the suffering when it comes to getting sick. 31% of our admissions were from the African American or Black population, 58% from the white population, and 8% from Hispanic. And that's being widely reported in the literature. This is not new for Berrien, or not only for Berrien County. It is across the country. Next slide. So of those that were admitted, we had 106 that needed the ICU. Obviously, those are the sickest of the sick. Many of them require ventilators. And you can see the proportion is just a little higher than the admissions for our Black friends and neighbors, and 51% for our white friends and neighbors. The deaths were a little proportionally lower for the Blacks than they were for and Blacks and Hispanics than they were for whites. So those sick enough to be in the hospital, we had more Blacks in the ICU and slightly fewer Blacks and Hispanics dying and slightly more whites dying of those sick enough to be in the hospital. Next slide. So what are those overall odds? These, I think, are very simple numbers and help put in perspective. The overall odds if you live in Berrien County is about 1 in 30 that you had a diagnosis of COVID. If you have a diagnosis of COVID, you have about a 1 in 9 chance of being sick enough to be in the hospital. That's a really stunning statistic. When people try to compare this with influenza, this is not influenza. Nowhere close to 1 in 10 people that get a diagnosis of influenza need hospitalization. And if you require hospitalization, about 1 in 6 go to the ICU. And if you require hospitalization, about 1 in 9 die. The overall fatality of COVID-19 is estimated all over the place, but usually falls somewhere in the 2.5%, 3% range overall. But of course, a lot of folks aren't sick enough to go to the hospital. If you get admitted to the hospital, the mortality rate is getting closer to 10%. That is a pretty significant number. Next slide. Here is a comparison of the age distribution by population. I'm sorry, there's a typo there, COVID cases and deaths. So you notice in the gray bar, this is the proportion of our population in Berrien County that is within the age ranges that you see there. Basically all decades with the exception of below 20 and above 80. So in the gray bar, that's how our population is spread. In the orange bar, that's how our COVID cases are spread. And you'll notice the young folks don't get their share of COVID, or if they do, they don't get their share of symptoms. So we're not testing them. For everybody else, they get a bit more than their share of cases. And you see in the blue bar, the mortality by those age cohorts. So if you're less than 30, you have essentially no risk of dying. If you're less than 20, you have very little risk of even feeling sick. But if you're between 30 and 60, you have about a 3.3% mortality rate. That's 3 in 1,000. That is starting to be significant. And that mortality rate is closer to what we see with influenza. If you're over 60, the overall mortality rate is 4%. That's a whopping number. If you're over 80, your chance is much closer to 9 or 10%. But overall for 60 to 80 plus, it's about 4%. This is the sobering fact. And this is what we've seen this now week after week. When we see those cases increase, our mind starts to calculate how many hospital beds are we going to need? How many ICUs are we going to need? How many beds are we going to need? How many ventilators are we going to need? And tragically, how many folks might pass away because of this disease? And we are on course, I think, for a really significant uptick in hospitalizations. We have 61 this morning. We could probably accommodate twice as many in the hospital with COVID, but recognize that is using every bed and hallways and other places because we still have a lot of sick people in the hospital that don't have COVID. And that COVID bump is just huge from what you'd normally expect in a flu season. Next slide. We participated in a community letter just begging people to take this seriously and be careful. We were joined by you folks and by a number of others in the community. Next slide. And we also have our own campaign, multimedia campaign, social media, and other places to help folks just understand the seriousness of this COVID pandemic. So with that, I'll take a breath and take questions or comments.
Any questions? Go ahead, Ezra.
Yeah, Mac. Doctor or Nikki, I have a couple of things here I want to look at. On our COVID numbers, this spike, what has been instituted by the state health director Figuratively, if every single thing there is followed, what does that do to our numbers? Number one, in Berrien County. That's the first part of the question. And the second part of the question is, are we seeing these spikes more in South County, Central County, or North County?
Nikki, you want to take that?
Yeah, I'd be happy to. So the second question about the geography and if there's any geographical pattern, no, there's not a geographical pattern. This is just pretty widespread across the county, across neighboring counties. I mean, transmission is happening everywhere. So there's not really a pocket of the county where you are safer or at more risk. And there should be an assumption that every person-to-person interaction could result in infection. Now, to your first question about the orders that are in place from Michigan Department of Health and Human Services, and if those are followed diligently, what the impact would be. I can't quantify that for you, but it would certainly slow transmission. What we're seeing when we have that really exponential growth and kind of in very basic terms, when one person infects 2 or more people, the outbreak is growing. And when one person infects less than one other person, the outbreak is slowing. And so what we would be looking for in those measures and adherence to those measures, wearing the masks, the social distancing, avoiding gatherings, avoiding contact with large groups of other people or large numbers of other people, that will help reduce the number of new cases coming from any case. And the more we have people who stop that line of transmission with themselves and don't result in any new infections, that's how we start to bend the curve, start to flatten things out, and then start going on a downward slide. It's really hard to quantify what that impact would be, though.
I certainly would agree with Nikki. I mean, the evidence is that the tighter the restrictions and the more the concern across our population, the more we blunted the curve. You can tell this and we can tell this when we go out. People in general are less concerned. They're less careful. You can certainly see from the numbers, if you're less than 40, you feel invincible. If you are between 40 and 60, you feel at some risk. You saw that. If you're over 60, you feel at a substantial risk. And so we see, and you've seen this, masks are no longer worn as often, covering the nose and mouth. People are not sanitizing as diligently, and folks are not maintaining the social distance as diligently. We know those things work from the data. We know those things are effective. The other thing that's really important, that the transmission we're seeing right now is almost entirely asymptomatic people. They don't know they're sick. They don't know they can give it away, or minimally symptomatic people that just feel this isn't going to hurt me. And so, younger folks tend to be reservoirs. They tend to spread it because they don't get quite so sick themselves and often aren't even tested. That asymptomatic transmission, in everybody's review of this, and there are multiple studies on this, that is the #1 source of transmission. Early on, we were seeing this in places like bars, full service restaurants, churches, large gathering, political events, those kinds of things where people weren't being as careful. Now we're seeing it because people are enlarging their social bubble, or they're being less diligent with those protective measures. So it's a great question. If everybody was creating social distance, hand sanitizing, and masking, we'd be pretty safe. And we'd see this curve blunt. Because that's not occurring, I believe that's why states around the country are starting to put these restrictive measures back in place. And of course, the fear is when we overwhelm the health system in any location, people die. Now, people will die because of COVID, but more people will die when you overwhelm the health system. I believe at Lakeland, we are going to run out of people before we run out of beds. We're going to run out of beds just before we run out of supplies. We're seeing supplies that we used to have weeks and weeks of, now we have a few days of. Testing supply is particularly the case. There's been a run on testing supplies across the world, and folks are not keeping up. And I believe we're going to be in this circumstance probably for another 3 or 4 months. We're going to start seeing some benefit when the vaccine becomes available, providing people are willing to take it. And that's a big if. Some will not. That vaccine will probably not be available till late December, early January. There are millions of doses in the stockpile, but spread millions of doses across a population of 380 million in the US or across the world. And you can recognize we're going to get just a few doses. It will easily be late spring or summer before there's enough vaccine to be effective. And consider this, I mean, it's a really important, 1 in 30 in Berrien County have had the disease. We are nowhere close to herd immunity. Nowhere close. You know, if 3 times or 4 times as many as currently have had it, 1 in 30, if that number goes to 1 in 10 before we get the vaccine, we will be so overwhelmed in the health delivery part of our county, we will not be able to keep up. Our models have been keeping track of the volumes for the last 4 or 6 months. And it is very predictive of what we see next week and the week after and the next month or so. Very predictive. They're running spot on those curves. We will be completely overwhelmed within 4 weeks if nothing else changes. And recognize that we're 2 weeks water under the bridge in that 4 weeks. 2 weeks of that has already transpired because it's about 2 weeks between the time somebody gets exposed before they get sick enough to want to get tested. And if they're tested positive before they're sick enough to be in the hospital, that can be, 10 days to even 3 weeks before they're seriously ill or pass away. So all of that's already transpired. Hopefully the new recommendations, tightening the reins just a bit, will remind people we are in fact in a pandemic. But I am seeing less concern and more complacency in my friends and neighbors. And you do as well as you're out shopping. And, it's very common to see folks not being as careful as they were in the summer. And the risk right now is 10 or 15 times as great. But folks are just tired of, they're tired of the restrictions. And I get that. So am I.
Thank you. Thank you very much. Appreciate that answer.
Can I ask a question? Have we learned anything from the contact tracing, like how it's being spread, or if it's coming from children, going back to school? If there's any conclusions on those yet?
Yeah, so what we know is that social gatherings tend to be the primary drivers. Social gatherings and household transmission are the biggest drivers of spread right now. Our evidence that we've been tracking very diligently since the beginning of the school year and even earlier is showing that children are not a significant source of spread. We actually have, amongst students that are going to school in person, there are lower than background levels of what we would expect. So amongst staff at schools and students in schools, we're seeing less cases than we are in the broader community. And the vast majority of the positive cases that are school associated have actually been community acquired. There's only a handful of cases where it's plausible that transmission happened in the school.
Can you explain what a social gathering kind of consists of?
I mean, it can be as basic as having friends over to your house for dinner or games or just hanging out. It's really getting together with people outside of your household. So small scale or larger scale. We've heard about there being different parties or events where people were together in larger spaces. But it can be small. I mean, we've seen that sleepovers have caused many school children to then become infected. There's a lot of that. It's really just getting together with people. It's not for work purposes. It's not for, shopping. It's not for any of those things. It's just being social together.
I agree with that. And we have seen that with the transmission within our team members at Lakeland. It is not the nurse working in the ICU with COVID patients that is likely to get COVID. Though what we've seen that are plausibly traced to our environment is break rooms, eating, and carpooling. It's where they just get together for just normal things.
Mm-hmm.
They're within 6 feet of each other. They take their masks off and eat and and we have to continuously remind folks, no, when you're eating, you need to be 6 feet apart. That dramatically lowers the case of transmission. When you're in those break rooms, when you're with folks for more than 15 minutes and 24 hours, you're much more likely to pick COVID. So it's a very similar, it reinforces Nikki's conclusions there. It's basically when people are close to each other and don't have a mask and aren't hand sanitizing.
Thank you.
Lauren, Bob Harrison. So have you gone to canceling elective surgeries and or limiting visitors?
Yes, we are limiting visitors just because it's so much harder to manage all the cleaning necessary. You know, you basically have to mop up after every visitor to keep the environment as clean as possible. On the elective surgeries, we're concerned about that for a number of reasons. You know, we did that for about a month and a half when this started, and it was hard to catch up because there's such a backlog of things that need to be accomplished. So at this point, we are not canceling elective procedures until we absolutely have to. And then, of course, for a shorter period of time, we are not seeing transmission to folks that are coming in for elective procedures. You know, we're testing them for COVID and when there's risk to stay over in the hospital. And of course, we're segregating patients to make sure that they're not commingled. So it's a very low risk circumstance. I expect within the next 2 to 3 weeks, if the trends continue, we will start having to cancel elective cases. As I talk to leaders of health systems across Michigan, and we do that every week with everybody across Michigan, everybody's experiencing the same thing. Now for Beaumont, who just got slammed early, you know, they're about the same place everybody else now and is saying, well, we can live with this because it's half what they used to have. Obviously for the rest of us that are going through this, it's climbing rapidly and we're going to be where Beaumont was in a month, it appears, if something else doesn't change. And if we get to that situation, then you have to cancel everything you possibly can because you just don't have the space to take care of the COVID patients.
Commissioner Freeling.
Carrie?
Thank you. Appreciate the opportunity to ask the question. So I know that you're probably both aware that there's been quite a bit of discussion recently about the different forms of testing for COVID. And I know that Lakeland just changed its protocol for the testing protocols for symptom versus no symptoms. Yeah. And the question that I'm hearing out in the public is the effectiveness or the rate of accuracy on the different types of tests that are out there.
Oh, sure. It's the wild, wild west of testing accuracy. Most tests are fairly accurate. When you're running thousands of tests, you will always get a false positive or a false negative. The false positive is saying somebody's sick when they're not. That's really rare. More likely to say the false negative, you say somebody's well when they're not. And of course, that depends on collection techniques and all kinds of other factors. In general, these are very reliable tests, but a very reliable test still might have a failure rate of 2, 3, 4, 5%. And when you're doing thousands of tests, there's lots of stories out there. But this test is no different than a mammogram or no different than a CT scan of your brain. You know, sometimes it picks up the disease and sometimes it doesn't. But overall, it's as accurate as most tests are. But the most reliable indicator is not how many test positives we have. The most reliable indicator is those are correlating with how sick people get, how many people need a hospital, how many people need an ICU, and how many people die. Those correlations are still very tight. So even if there's a bit of error rate of a few percent, the best predictor of how this is going is what's happening with those that are getting sick enough to need oxygen and ventilators, and those sick enough to die. And the correlation with our increased rate of positive tests has been 1-to-1 with how many people need to go to the hospital and how many people end up in the ICU. So I would just say, of course, to anybody ask that question, and it mostly doesn't matter. You know, look at the numbers that really matter. People are getting sick. They're going to the hospital. They're needing an ICU or ventilators, and they're dying.
And from a bit more of an individual person. Oh, I'm sorry. Go ahead. Do you have a
follow-up?
follow-up?
Oh, no, go ahead, Nikki.
Well, so I was just going to say
have
from an
one follow-up.
individual perspective, when people are trying to figure out, well, what do I do with my test results? Because I know a lot of people have been thinking, well, I can still go have this, I can go have my traditional Thanksgiving if I just go test negative beforehand, or I can travel, or I can do these things, or yes, I was exposed, but I now have a negative test result. So there's some individual choices that I think a lot of people are making based on the results. And I think sometimes it does lend people to think, well, how good are these tests anyways? this isn't exactly what you asked, but I think in that is this importance and understanding. A test can also only tell you what is going on with you at the exact moment that the specimen was collected. So even if you get a negative result 2 days later, that doesn't mean you're not infected that day. Some of the rapid antigen tests that are in use, not within Spectrum Health Lakeland, but with some other providers in Berrien County, and particularly in Northern Indiana, those do have some different specificity and sensitivity where you are a little bit more likely to maybe get a false negative or a false positive. And there's some extra interpretation that needs to happen based on potential exposure and symptom profile and all of those things. So sometimes with those rapid tests, it is warranted to then get a PCR test, which is the type of test that Spectrum Health Lakeland uses predominantly.
Which falls in the accurate category, one of the most accurate categories.
Yes.
You know, I can just tell you, Brother Lowell, my twin brother, had a negative test, minimal symptoms, and we said, stay home, don't come back to work, although he had a negative test. You know, to Nikki's point, he had some symptoms that led us to be concerned. 2 days, 3 days later, had a positive test, and, you know, a week and a half later, I watched his pulse drop to 18 and his systolic blood pressure dropped to 50 and expected death within 30 minutes.
Yeah.
You know, that, and there's story after story like that as well. So there's always interpretation to these tests that are a really important part of it.
Absolutely. Which leads me to the other portion of my question that I had. Dr. Hamill, you had mentioned about a lot of the individuals could potentially be asymptomatic. And while we're waiting for some of the more traditional test results to come in, I know that there's a bit of a delay there for a couple of days, particularly with the amount of tests that we are, you know, processing. So how is that affecting our community as we wait for those results as it relates to isolation?
Yeah, no, it's a really important question, you know, and it harkens off a little bit of what Nikki just said. If there's any concern about COVID, folks should quarantine themselves. You know, they should stay at home as separate as they can from their own family, using different bathrooms if you can, being careful about sanitizing around the kitchen, staying in different bedrooms. I mean, that's important. Lowell didn't give COVID away to a single Lakeland team member, including the leadership team that he was with every day in incident command, or a single family member. You know, it's because you have to be committed. Let's not spread this. Why I'm tested negative, but might be positive. And so you just have to be diligent in that way. But it is hard. You know, folks say, well, I'm waiting for the test. I think I'm just going to run to the supermarket. You know, I'm waiting for a test. I think I'm going to have my friends over for dinner. I don't feel too bad. And that is what's causing the increase in asymptomatic transmission. Folks feel their risk is low.
And the guidance does say while you're waiting a test result, you need to isolate.
I appreciate that. I appreciate all of your answers. Thank you.
You know, and I would just say the other little part that has made this difficult, and you folks know this, I'm not saying anything that you're not all aware of, is we unfortunately in the middle of this pandemic had an election year. And so this is a time we should have all come together, and it's a time that we've been polarized. And it depends on what news you're watching, it depends on what you're reading, what you believe. And that has made this epidemic much harder to manage because you can always find a view or an opinion that says, oh, it's not so bad, or we're going to get over it, or let's just wait for herd immunity. I get all of that, but look at the data, look at the numbers, look at the lives lost. And look what's happening in Berrien County. And I just would implore my friends and neighbors, boy, we have to take this seriously for the next several weeks or several months until we can start turning the corner with seeing the curve flatten, having a vaccine available. Fortunately, we do have better therapeutics. You know, when this started, we did not have convalescent plasma. We didn't have remdesivir, which probably doesn't work all that well, but works a little bit. We didn't have monoclonal antibodies. We were using dexamethasone. All of those things are in play now. And we've learned that from the nearly 250,000 studies since this began. We have never in human history had so many people researching the same problem and publishing on the same problem so rapidly. We literally have hundreds of thousands of research studies that we're basing our treatment on. And I can tell you, all the epidemiologic research, Nikki is seeing that all, suggests we have to be careful or this won't go away anytime soon.
May I ask a question? Mr.
Yes,
Chair?
ma'am.
That's
Yes,
Minnie
ma'am.
Yarborough, City of Benton Harbor. This is personal, but I want your opinion if you can. Do you think COVID was in the United States before January, March? And I'm going to tell you why I asked this. My husband in November became extremely sick. He's at Westwoods of Bridgman. In November, he went to Lakeland. His temperature was 106. His blood pressure was 66. I had to sign all kinds of papers. He was in the hospital 12 days. They did all kinds of tests and they were never able to say what he had. They first said pneumonia and they left that alone. And he got better. They had a needle in his neck and just all kinds of things. Now they're testing every day or whatever at Westwoods, and he is negative every time. So I want to know, do you think COVID was here before January? Do you think that a person is immune after they've had it? Those are the things that, and that's why I'm asking this.
That's a really good question. There is evidence that folks probably there are probably clusters of COVID in this country before we diagnosed it, before we had any tests. And most folks believe that. Yep. November is a pretty early date because, that's when things started showing up in retrospect in China. We're showing up in November. It's not impossible, but there's no way to prove that because we can't go back and test his blood then. Related to immunity, that's a really challenging topic. We are finding that not everybody makes an antibody. Not everybody who makes an antibody keeps an antibody. You might make an antibody and then have it go away 3, 4, 5 weeks or a month or 2 months later and not keep it. Now that means somebody might be susceptible to get it twice. Now I don't know about your husband because I can't prove whether or not he had it or not. It was real early. If you'd have said January, I'd have said, yeah, pretty maybe. If you said February, I'd say very likely. It's early in November, but it certainly is not impossible. And of course, there are viruses we can't name. There are viruses we don't have tests for. We have a name for this and a test for this because so many people got sick. And so then there's research behind it and we can put a name to it and we can test for it. But it's a very interesting story.
Thank you.
Where can you get tested for antibodies? I know there's a lot of tests to find out if you've got COVID, but I have not heard too many places for the antibodies.
There are 13 or 14 testing sites in Berrien County, and many of them will do antibody tests. There's debate on what gets paid for by the government or what gets paid for by an employer or an insurance company and who qualifies for what kind of test given the shortage. So it doesn't mean they're easy to get, but they are available around Berrien County. And typically we don't use that much for just curiosity, just because it's so short supply. There are folks that will say, I think I might have had it in January. Can I get tested? Well, maybe someday, but they probably don't rank high enough on the concern list to warrant a test from most folks that are offering tests at this point.
If I can ask a question, Nikki, you had mentioned the antigen test and the rapid test is not exactly what you would consider to be the right test to take?
I don't know if I would characterize that as what I said or what my opinion would be. There's absolutely a place for a rapid antigen test, but there's a lot of interpretation that needs to go into it based on exposures and symptoms to really know what, there are times when if you get a positive result, you must confirm it and you shouldn't just take it at face value. And there are times when you get a negative result and you must confirm it and without taking that at a face value. So there's a lot of things that go into that interpretation. There's absolutely a place for that though, because getting the rapid results within minutes can be very important. So there's a lot of those trade-offs that that need to be taken into account to using which test in the appropriate setting.
We have experienced that a lot in healthcare. We use rapid tests. If you come to the hospital with a hip fracture and we're concerned that you might have COVID, we're going to put you in a different unit if you have COVID, obviously. And we'll use a rapid test to say, is it likely you also have COVID? And of course, we've discovered that many times. And to Nikki's point, you may have symptoms that are significant enough that we don't trust the test if it's negative. And we'll put you in a place that is safe until we can repeat the test or run a test that we get back tomorrow or the next day. There's always interpretation with that rapid test.
Thank you for that clarification.
And I would just ask you folks as our leaders, what can we do together? What can we do to telegraph to our communities it's not over yet? We know you're sick and tired of this. We know you want a normal life. We know you want to spend time with your loved ones. Are there ways we can do that, express our love and affection toward those we care about at a safe distance? Is that possible? I believe it is. And I believe if we're able to do this together for the next few months, we will absolutely save lives. We are going to pass 100 lives soon in our little community. And in the country, we've lost 250,000. I suspect, my own prediction as I look at the models, that we're going to lose twice that many, at least in this country. I think we're going to get to 500,000 before we turn the corner. I don't want to get to 200,000 or 200 in Berrien County with only 154,000 residents. And I don't want to, as you can tell by looking at the graphs I shared, I don't want to put that burden on the elderly parents and the grandparents and the great-grandparents that are such an important part of the fabric of our lives in this community. And those are the folks who are most likely to lose. And the folks that are most likely not to take this as seriously are the folks that just are at lower risk. And I get that. It doesn't feel as personal for them. But whatever you can do to help make sure that we're being diligent and being prudent and being careful, we have a much greater chance of not exhausting our health system. We have a much greater chance of not having to ration care. And that's happened everywhere. This has gotten more prevalent everywhere. Many countries and many large cities have to make tough choices on who gets that ventilator first and who has to wait. And I'm just hoping we don't have to do that in southwestern Michigan. I really appreciate, Brian, your inviting me to participate. I'm happy to spend time with leadership in this county anytime you need it on any topic. But this is a timely one, and I really appreciate your interest in it.
Lauren, this is John Hinkleman. I've got a question for you as it pertains to just your hospital policy. What is the hospital's current policy for allowing patients who need life-saving care into the hospital? Say, for instance, someone's having a heart attack, and are you allowing them into the hospital?
Absolutely.
All right.
Absolutely. We're doing everything we can to save every life. So it would only be elective procedures that would ever need to be curtailed. You have to care for the strokes and the heart attacks and the sepsis, the life-threatening conditions that are occurring every day. We have to see those folks.
But there was a short period of time ago, where somebody was having a heart attack, couldn't get into the hospital until they passed the COVID test.
Oh, you won't be admitted until we have a COVID results, but you'll be in the hospital getting all the care you need. We will often hold people in the emergency room. In fact, we've built a new short stay unit in our emergency room where we can hold people up to 24 hours. They get all the necessary care, all the consults, all the tests. They just don't get admitted to that final unit. And of course, that's really important. If you're on that unit with a hip fracture and you don't have COVID, you're hoping that somebody with COVID doesn't end up in a bed next to you or in a room next to you. So we have to know that COVID status, if at all possible, to keep everybody safe. But we will not turn you down for care. You'll get all the care you need.
But you can't get into the cath lab, for instance. You couldn't get into
no. You'll go straight to the cath lab. If a person is having a heart attack that necessitates an emergency treatment, you go straight to the cath lab, and everybody there is going to be in full COVID protection. That's the protocol. If it's not that urgent, and we can know, we can't burn through all the extra PPE if we don't need to. It's just not enough to go around. If it's safe to wait for that rapid test, we will. It's not safe to wait for that rapid test. You're on the way to the COVID or to the cath lab, and everybody's in full COVID gear.
Has your policy always been that?
Always been that. Yeah, it's always been that. You know, there are times where the condition doesn't warrant a race to there are things we need to stabilize, there's medications we need to give, there are tests we need to get back. So there are all kinds of times where that race to a cath lab isn't in a patient's best interest. But there are strict criteria from door to balloon under certain circumstances when they're test positive that suggest myocardial damage, that we're rolling down that hall before all the tests are back because we know you need to end up in the cath lab. And that's always been the case. That's a good question.
Okay, thank you very much. Are there any other questions for Dr. Hamill or for Nikki Britton? If not, you're both able and welcome to stay on for this meeting. However, I would expect you would probably have other things you need to do, so we will understand and wish you both a good rest of the day.
Thank you very much.
Thank you. Thank you.
Okay, we'll move on to the Finance Committee, Madam Chairman.
Thank you. I would like to let you know our entire committee was present. We had a number of presentations and very interesting. And Annette, may I ask, do all of our commissioners have a copy of Chris Swihart's work, the work that he needs to do?
They do not, but we can make that happen.
Yep,
Would you
within a couple of minutes.
Thank you, because he has a grocery list of, he was asked by Administrator Doucette to put together the things that we need that would fit within the CARES Act. There are many things that he told us about, and you will see them on the list that you will receive, that he had planned to do in 2021, or that he needed some things that were at the end of their life, blah, blah, blah. But with this, his work and his charge is by December 31st, before December 31st, to have all of these items engaged, that we will have signed, that we will have received bids, that we will know that they will be done so that they can go under the CARES Act. They must be in that condition by December, the end of December, for them to be financed. And Administrator Doucette has said everything that we need to make things work. Because we are so heavily involved with virtual, with Zoom, with all of those things, that is what he's working on. I think many of us got a chance to see it when we came for the budget hearings, that there is a screen there that we're on there as participants. It's being worked from there. But the proper thing is that there be a camera in the ceiling, that there be a proper screen, that those kinds of things, that room be made ready for virtual, because this is something that's not gonna, we don't know when it's gonna stop, but to have the top equipment that we need. And Director Swihardt knows how to make that happen. And so that's one of the things we're working on. There are, in all the buildings, there are, when they say bridge, I didn't know if they meant like, you know, over the river, but it's just to connect us well with the courthouse between Empire. You know how important that building is. That's our 911, our dispatch. All kinds of things that are needed, that's what they're working on. And you'll see all those items on that piece of paper. So we, as the Finance Committee, agreed for them to go ahead and get all things going that they can. If we need to meet extra or for a minute or whatever to be able to approve something or to make something happen, we've all agreed to be available so that can happen. And I think that's the best way for me to explain it rather than trying to go into any kind of detail. We're all learning more and more as we go. But we trust that Chris will get the best deals and Administrator Doucette, they will be working together. And all that's in the CARES Act. Another thing that we talked about was board appointments. We have a number of vacancies on the Planning Commission, a number of vacancies on the Public Works. And what we have done, we would like, are we able to do that today, Annette? But,
so I went ahead and prepared the sheet to do board appointments. I did send that out in an email in between finance and this board meeting. and I provided one to the chairman as well. So I believe that, I think, like under other business, you can probably do that.
Good, because it was suggested by Commissioner Scott that rather than with so many things that need to happen by December 31st, that we'll go ahead and accept these two candidates for these committees, because they've been talked to, they are interested still in being on the committee, and we'd like to bring that to you today rather than waiting until December 5th. So that will be one of the things that we have completed, that we would appoint these two gentlemen to these committees, and you receive the information. Then another thing, at the front of the court, there is a need for a remodel project. It's so close together, and for distancing and for the need to use some of the space there, we're doing another thing that's on a fast track. And what we've done, our administrator has gotten in touch with Avonmarsh, and they have drawn an architectural plan, and it's with the input of the front of the court staff, the court administrator, the employees in the building, and then building and grounds, so that they can say this is the best use of this space. Again, this is money that can be used under the CARES Act. And so out of Norm, what we have done is engaged Avonmarsh for a fee of $7,000 to come to us with a plan and with bids from different companies that do this, so that before December 31st, we will have this work engaged. There's a real need for it, and they're going to be able to do it and be able to start soon, because the courts are closed. So they're normally, you'd be concerned about so many employees and so many people are working from home. All of this can happen, and it won't be done by December, but it certainly will be engaged and on its way. And we as a finance committee approved that and gave our agreement to being able to do that. Again, knowing that should we need to meet or look at something, that we will be available to do that. And then Warren Parish did something, approved the updated apportionment, something to do with the election in different precincts and things. If we wanted to know anything about the District 5, then we have to ask our clerk, and she can explain that to us, the district where there was a tie. If there are any other things, commissioners, will you let us know? Finance Committee, anything that I missed?
No, any questions for finance? Ezra?
No.
Do you have something?
I think Mamie hit all the highlights.
Okay. All right, well, we'll look for public comments regarding resolutions. Just resolutions at this point. All right, well, we'll keep moving. If a question pops up or a comment, we'll reel it in. Consent calendar. Any changes to the consent calendar?
May we add that one resolution about the Planning Commission and Public Works? That be added to that? Mr. Chairman, Mamie Yarborough.
Stand by one moment, Mamie.
All right.
Annette, go ahead.
Yeah, so the appointments that you're gonna do that's not by resolution. That's just gonna be in other business. I have the board appointment sheet to do that. The equalization apportionment report that you might also be referring to is already on the consent calendar. So that's already covered.
Thank you.
Okay, yeah, we have.
Can't hear you. Go away.
We've lost volume from the conference room.
I'm so sorry. Got it.
Sorry. It's hard to read lips from this distance. Anything else as to the consent calendar?
Mac,
Bill?
just a question, sir. Resolution 1342, I know there were a couple of different versions of that circulating. Do you know which one is on the consent calendar at this point?
Oh,
Hold on.
the salary.
The one that's appended to my agenda is dated November 10 in terms of when it was initialed by corporate counsel and the administrator. Is there something since then?
I don't know, and that was had out there at my request. And I can't move off of what's.
I see November 19th.
Mac, if you would look at that and in favor.
Oh, November 10th.
Hold on, man. Go ahead, Bill.
If you would do me a favor, and look at that and see if that is a 1 year or a 2 year increase for elected officers.
The resolution that I have is for calendar years 2021 through 2022. So I would interpret that to be a 2-year resolution providing a 2% increase in each of those calendar years.
Right. I would request that be removed from the consent calendar and put aside for future discussion.
Future discussion, meaning after we do the consent calendar?
Yes, sir, please.
Okay. All right. Well, we'll pull the resolution ending in 1342. Anything else as to the consent calendar, or are we ready to vote on the consent calendar minus 1342?
Mr. Chairman, this is Commissioner Curran. I would make a motion that we approve the consent calendar minus resolution ending in 1342.
Thank you. Is there support?
Yes, Mr. Chair, I'd like to support Commissioner Scott.
Moved by Curran, supported by Scott. Any discussion? Hearing none, will the clerk please call the roll?
Curran,
Yes.
Freeling,
Yes.
Harrison,
Yes.
Hugel,
Yes.
Hinkleman,
Yes.
Majerick,
Yes.
Meeks,
Yes.
Scott,
Yes.
Borak,
Yes.
Yarborough,
Yes.
Chickering,
Yes.
Elliott.
Yes.
12 yeas, motion carried.
Thank you. Now, P 2011342. In order to move that forward for discussion, is there a motion to do so?
I would so move.
Moved by Chickering. Is there support?
Support that.
Supported by Majerick. Discussion. Bill, why don't you lead off?
This is late breaking, and I apologize, but it's an issue that has just come up really this morning. The resolution as proposed, 1342, provides for 2 years of 2% increases for elected officers, including the Board of Commission. That is consistent with our past practice. And probably it's a good thing I'm a lame duck so I can bring this up, because I would, in all deference, not want to deny my peers here an increase. But I think it would be cautious and appropriate for us to break this out and provide the increase for 2021 as needed, but withhold judgment on what happens in 2022. As we all know, we are very much up in the air in terms of budgets, et cetera. And I think it would behoove us to provide the budgetary process next fall to determine what the increases are for 2022. Now, I've had some brief communication with corporate counsel, and I don't know where John stands on this at the moment, but I do think this is something that is worthwhile to consider. Who knows what kind of increases can be afforded for 2022 as we sit here today.
Board members.
Mr. Chair, this is Commissioner Freeling.
Yes, Jerry.
In reviewing this resolution, I know that we had discussed it in committee last week. And out of just what was normal protocol, I said I was comfortable supporting moving it forward for full board discussion. And it was an oversight on my part, seeing that it was for 2 years. I went back and I looked at our past practice for this board of what we've done historically, and we've historically only approved 1 year increments. I looked at 18 and 19's resolutions, and it was for 1 year. I also went into our handbook, the manual that we get for the new commissioner school, of what is standard practice for adopting salaries for elected officials, and just wanted to make sure that that was not something statutorily that was placed, that we needed to do a 2 year. And considering my caution that I feel with our budget, I'd be supportive of the 1 year, but I echo what Commissioner Kern's sentiments are of, holding off on moving forward on 2022 until we really have a good idea of where we're heading in this road for dealing with the COVID response. Those are my comments.
Thank you. Does anyone know, Bill, you mentioned past practice. Has it been our practice to do these every year, or to do them every 2 years prior to the start of each term for the Board of Commissioners? Each new term.
I will defer to Terry's research because she's very good at that kind of thing. The information I got from administration again this morning was that it was typically 2. I don't know that that's a binding thing or whatever. I think I'm more appealing to logic and economics and the life we're living these days. So I trust that what Terry says is absolute truth.
I'm told that the increase for each year for the elected officials would be $16,000 if you add it all up. Treasurer, clerk, prosecutor, register of deeds, drain commissioner, all together would be $16,000. And that for the 12 members of this board, that 2% increase would be approximately $3,500. So it's a roughly $19,500 expenditure for the 2021 budget, and I'm told it would be within about $200 of that for the 2022 budget. So you're talking under $20,000 a year times 2. Does that square with what PHS committee has in terms of your information?
I very much trust those numbers. I think what I'm raising, Mac, is as much a public perception, an employee perception as anything else. To predict 2% increase for us, since the sheriff is there as well, for 2 years out, when we have employees who expect increases for 2022, we don't know what staffing budgets, employee costs, and things like that are going to look like in 2022. I think in the exercise of financial caution, it makes sense to defer that and treat that as a personnel expense that cuts across all of the county together. That's just my opinion.
Here's the other thing. I'm looking at this email you were referring to from Judge DeWayne which I hadn't had time to read because I was on the road, but it's 9:17 a.m., so about an hour and a half ago. And it references MCL 46.415 Parents 3. MCL, as you know, being Michigan compiled laws. And in pertinent part, it says, changes in compensation shall become effective only after the time members of the County Board of Commissioners commence their terms of office after a general election. That would mean any changes in compensation would take effect in January of 2021 for purposes of this discussion. But it goes further and says those changes in compensation will take place after the election, after a general election at the start of the new term, provided that the change is voted on before the commencement of the new terms of office, which means any change for 2021 would have to be voted on in the 2020 calendar year between November 3 and December 31. So that would be a given. If you want to increase salaries for elected officials, you have to do it right now, or by New Year's Eve, at least.
Correct.
So then the question is, traditionally, have we done this 2 years at a time? I don't remember. I just started here a short time ago, so I don't have any memory. So I truly, honestly don't remember how we've done it. I just know we've done it at the end of the year. So can somebody tell me, Terry, maybe you've got it, Annette, somebody tell me, have we done this traditionally as a 2-year thing to avoid any trouble under that statute that I just read?
So, Mr. Chair, this is Commissioner Freeling. The resolutions that I pulled from our county's website to, refresh my memory are numbers. There's a whole series of them, and they're not the complete resolution, but 1213-2018-2739. I'm saying this for Annette's benefit, so she can maybe quickly pull that up. The other one was 1212-2019-3300. So one of them is for the year 18 and the other is for the year 19. What I had seen when I reviewed that was that it was just for 1 year each time.
Excellent.
I'm trying to pull it up myself right now at home, and I'm not having much success at it.
Terry, are those resolutions for elected officials or for appointed?
I believe that they were together.
They normally would not be. And I think appointed we have done annually.
Yes.
That I'm pretty sure of. But what I can't remember is if we did elected for 2 years. I'm kind of leaning towards thinking we must have, because the way I read that statute is any changes in compensation have to be voted on before the commencement of the new term. And the new term starts January 1, 2021. I know we can't cut anybody's pay during a term of office, any elected official anyway. But this kind of makes me lean towards thinking we must have been doing these 2 years at a time because of the wording of MCL 46.415.
Or we didn't. We didn't.
Wrong.
So, from a budget standpoint, it's $20,000 against $70 million times 2.
Mr. Chair.
Yes.
I have been able to find the 2018 are elected. I was looking up on our website with the same heading that this resolution was listed as, and that's why I pulled up the other resolutions. P1811352 is the resolution, and I do stand corrected that it is for a 2-year period for both January 2019 and January 2020, that those increases were voted on.
Would make sense based on my reading of 46.415, which would seem to limit us to doing, we have a window between the general election and the end of the calendar year.
Yeah.
And that's it.
That's it.
So, again, I recognize it's not about the dollars, because you're talking, I used to be good at this, but I'm going to say 0.00005% of our budget, which would be 5/100,000ths of our budget. But I appreciate the symbolism. Understand, though, if we limit it to 1 year, all elected officials will be denied a salary increase for 2022.
Mac,
Not just us. Yeah.
Mac, Commissioner Scott here. I have a question. I understand what we've always done, the trends. I agree with Commissioner Chickering also into the fact that we are in unprecedented times. I think everybody realizes that 2022 is going to be quite the leaner year rather than 2021 is already, we're seeing an issue. If this does pass today for the 2 years, I believe the board has the authority at any time to amend the budgetary process for any year. Regardless of whether or not we approve this or not approve it, we have to do something before the end of the year per the statute. But I also think the board can amend, and we can kind of, if you want to say, go with the flow depending how things are going. And I'm sure we could talk to the other elected officials also and see what their thoughts are, not knowing what the economy and what the money situation is going to be like projected out in 2022.
Well, you're correct. We can do an amendment that would impact the 2022 budget. Anything we do today, if we do an increase today for the next term, 2021, 2022, once January comes, we can't change the compensation for any elected official in January. That will be locked in for that calendar year. However, at any time during the 2021 calendar year, we can change 2022.
Right.
But once January of 2022 gets here, then that one gets locked in for that calendar year. So yes, we do have flexibility for the 2021 calendar year as to 2022. Now, I want to hear quickly from Shelley and from Brian about their information that bears on this resolution. First, Shelley, then Brian, because she outranks him.
Yeah. Thank you, Mac. Could I have that in writing, please?
It's on the internet.
It's true. It's on the internet. That's right. Members of the board, I'd like to remind you that Sheriff, I believe it was in early 2000, so 2001, maybe 2003, all the elected officials realized what a budget crisis there was for the county at that time. And the 6 elected officials came to the county board and asked to forego their raise. I think you've always seen that we have very caring elected officials, and I think that if you talked with them and showed that there was a severe budget crisis in calendar year 2022, our elected officials would step up to the plate.
I do remember that. Thank you. Brian, what's our health look like budget-wise?
So this year, we're going to close out, now we are greatly assisted by the $1.8 million worth of CARES Act funding. We will close out completely replenishing our contingency fund, and we anticipate that fund balance will grow as we close the calendar year. To predict what 21-22 looks like is unknown, but for right now, your fund balance is growing. We continue to hover at approximately 40%. Does that address your question, sir?
It does. So would it be safe to say the less than $20,000 increase in the salary line item is inconsequential?
I think that's a fair statement.
All right. Anybody have any other thoughts on this before we call the question?
Could you repeat the motion again, please?
Well, the motion was per the wording of P2011342, which calls for a 2% increase for elected officials for the 2021 and 2022 calendar years. And that was reported out of committee, the PHS committee. For our discussion today, it was moved by Commissioner Chickering and supported by Commissioner Curran, I believe. Or Majerick, I'm sorry, Majerick. Okay, so with that, if there's no other discussion, will the clerk please call the roll?
Freeland.
No.
Carrie?
Harrison.
Yes.
Hugo.
Yes.
Hinkleman.
Yes.
Majerick.
Yes.
Meeks.
Yes.
Scott.
Yes.
Borat.
Yes.
Yarborough.
Yes.
Chickering.
No.
Curran.
Yes.
Elliott.
Yes,
You have 10 yeas, 2 nays, motion carries.
motion carries. We did not have added resolutions. We had some discussion about board appointments, Mamie, and we're going to be doing those toward the end of the agenda.
Okay.
Commissioner reports. Anyone have anything to share?
Back. Commissioner Scott, I have nothing under commissioner reports, but I just thought of this. Could it be reflected in the minutes on what I had said prior about that last salary increase for elected officials? That we need to look at these as we go by, and the board does have the authority to change that in that calendar year of 2022. All I'm looking for is if there is a actual record of that so that it'll be in the minutes.
Any objection? All right, hearing none, Madam Clerk, will you so reflect in the minutes? Let me put eyes on the minutes before you finalize them. All right, very good. Thank you. Thank you, Ezra.
Thank you, sir. Appreciate that.
Yes, ma'am.
Mr. Chairman, Mamie Yarborough. I am the chaplain of Berrien County Commission, and we pledge allegiance to the flag of the United States, and we have a prayer. But I have a verse that I would like to share with the commission. Next Thursday is Thanksgiving, and I'd like to share this verse if I could. Would that be all right?
Yes, ma'am.
It's from Galatians 5, verse 22. It says, but the fruit of the Spirit is love, joy, peace, forbearance, kindness, goodness, faithfulness, gentleness, and self-control. Against such things there is no law. Those who belong to Christ Jesus have crucified the flesh with its passions and desires. Since we live by the Spirit, let's keep in step with the Spirit. Let us not become conceited, provoking, and envying each other. Amen. Thank you.
Amen.
Thank you.
Thank you, Mamie. Anything else under Commissioner reports? Hearing none, we'll move on to Administrator report.
Mr. Chair, members of the board, as you all have been working through your agenda today, our Director of 911, Caitlin, has reached out just noting that she is on a bit of a time crunch to get some tower agreements renewed. I've emailed the admin committee chair. Jim, are you willing to come in next week? It would be via Zoom. I know we're bumping up against the holiday, but if we can get admin scheduled for Wednesday at 9:30, it would allow us to get one of these agreements wrapped up.
Hey, Brian, you want the admin committee, all four of us, to come in person?
No, just via Zoom, sir.
Oh, yeah, I'll defer to the other committee members, but I'm sure I could probably make it.
I'm fine with it.
I'll be with you.
Now, I'm noting that
we're
going to make this
at 8:30, 8 o'clock, 8:30?
9:30?
Oh, Monday at 8:30.
Wednesday at 9:30.
I'm saying I can't make it Wednesday.
Oh, okay. Now, I'm also going to note that I'm kicking Annette out of the building on Wednesday, so we're going to make this work, but she's not going to be allowed to be part of it. I think she's got some holiday plans.
So is that going to get approved just at the admin committee level? That's not going to go? Okay.
Yeah, so we would then bring it back to the full board at one of their meetings in December.
Okay. All right.
All right, and then the other item, just for the board's update, Chairman Elliott worked with me. We had a nice team up this week between leadership from Whirlpool, from DC Cook, several local nonprofits, just issuing a statement, just reminding the public to give serious consideration to the CDC's recommendations on how to avoid COVID-19. So I'll forward out that completed statement to all of you, and just a big thanks to the chair and everyone else who worked on that project. Mr. Chair, those are my comments.
Thank you. Sheriff, did you have anything to add?
I do. I just wanted to talk to the commissioners a minute about the jail and thank each and every one of you for having the foresight to approve the UV machine, the mister that we bought, and the full-time cleaning person that we have in there. We have 254 people in jail today, and we test everybody that comes to jail within 24 hours. And we send that test out to California. Once we get those results back, they're logged in at our medical department. We also do testing at Lakeland if we need a test in a quicker manner. But with all the cleaning and all the testing we do, today we only have one positive test inside the jail. That person is in isolation until they are quarantined for the 10 days. So I think everything that we've done in there and the equipment that you've allowed me to have has cut the numbers down. As Dr. Hamel was saying, the numbers are going up. I'm getting a lot of people coming to jail every day, 254 people in there, and only one is positive. So I want to thank my nursing staff. Karen Thomas has been working 7 days in a row for the last couple months. Of course, on Saturday and Sunday, she comes in and does the testing for a few hours that it takes her, and then she goes back home, but she's been putting in a lot of extra hours. She's very dedicated, and I owe her a lot for her dedication. as well as my staff as we move through this pandemic. But just want to give you an update that if you hear anything about the jail, it's clean, and we are cleaning every day, and that goes to show you that we're keeping COVID out of the jail from all the things that we're doing. So thank you.
Thank you, Sheriff. General public comments.
I have asked, we have like 18 people watching today.
Wow, that's
And
good.
I have asked 3 times, and it does not appear as anybody has any general public comments for you guys. So,
Okay. Any other business? We'll get there. No, thanks. I probably would have forgotten.
Do we have
Yes.
board appointments?
Yes, Diane just reminded me. We have 2 of them. Per Finance Committee's recommendation, Daniel Stanage to Public Works to fill a vacancy, term expiring the end of next year, end of 2021. And Lee Vangenhoven for a Planning Commission vacancy expiring the end of 2023. Could do those in one motion if you'd like.
Mac, this is Commissioner Scott. I'll make that motion that we do both of those board appointments in one motion.
I would
Thank you.
support that.
Commissioner Harrison, I'll support that.
Okay, Terry got there ahead of you, Bob. So moved by Scott, supported by Freeling, and endorsed by Harrison. Will the clerk please call the roll?
Harrison,
Yes.
Hugo,
Yes.
Hinkleman,
Yes.
Najaric,
Yes.
Meeks,
Yes.
Scott,
Yes.
Borat,
Yes.
Yarborough,
Yes.
Chickering,
Yes.
Kern,
Yes.
Freeling,
Yes.
Elliott.
Yes,
Motion carries.
thank you.
okay. Thank you.
Any other business? Announcements and reminders. We'll close 26th and 27th, next Thursday, Friday. By implication, that means we aren't meeting either. So this is our last meeting for the month of December, last board meeting. We will have a COVID briefing, however, tentatively scheduled next Wednesday at 11 a.m. Yesterday, it's my understanding, a new vaccination became available for shingles, replacing the one that was developed about 15 years ago. I'm noting that because about 10 days ago, 12 days ago, I came down with shingles. And since then, it has felt like from time to time, someone is coming up and hitting me in the side of the head with a 2x4. Which is why if you're not here, you can't see the left. My neck is red, my left ear is red and swollen. And the good news is, even after you're stupid like me and don't get a vaccine, even though your wife reminds you to do it and you forget, and then when you come down with it, in all kindness and with love, she says, "I told you to get that vaccine." But the good news is you can still get vaccinated even after you have shingles. So once it clears up, I'm going to get the vaccine. I would encourage anyone who is 50 and above, get the new vaccine. Apparently it's a one-time, you don't have to get 2. And the old one, they just literally stopped using on the 18th, which was yesterday, and all the pharmacies, I'm told, have the new one in full stock, and I can't wait until I can go get it. So with that, if we don't have anything else, I'll entertain a motion to go into closed session under MCL 15.268, which is the section that deals with consulting with an attorney involving pending litigation.
Point of order.
Is there a motion?
Point of order, Mr. Chair. There was other announcements. I was waiting until you were done with your shingle story. Today, the Land Bank has a 2 o'clock virtual.
yeah.
And we also have a 4:15 bid opening for the Finance Committee. Finance is having 2 meetings today.
Right again.
I just wanted to make sure that the 18 people in the multitudes would know this.
Well, thank you. And in fact, Brian did mention that to me this morning, and I promptly forgot. So thank you for bringing it up.
Thank you. Now you can do your motion.
Okay, who moves to go to suspend this open session, go into closed session under attorney-client regarding pending litigation?
Commissioner Meeks, I'll make that motion.
Moved by Meeks, is there support?
Commissioner Harrison, I'll support the motion.
Harrison supports. Will the clerk please call the roll?
Hugo,
Yes.
Hinkleman,
Yes.
Jerry,
Yes.
Meeks,
Yes.
Scott,
Yes.
Walrath,
Yes.
Yarborough,
Yes.
Chickering,
Yes.
Kern,
Yes.
Freeland,
Yes.
Harrison,
Yes.
Elliott.
Yes.
12 yeas, motion carries.
Thank you. We are now in closed session. I see